Hello, my name is Dr. Rory Murphy, and I'm going to go through the important considerations and explain in depth the anterior cervical discectomy infusion. First of all, I'm sorry that you're having challenges and pain and symptoms for your neck, but the good news is we have many excellent ways to help. One of these is the anterior cervical discectomy infusion. In this procedure, we go in through the front of the neck and we make a small incision approximately 2 inches in length, generally on the left-hand side. We then carefully move the structures away, and surprisingly, there is very little between us from the skin down onto the spine. We carefully swipe up and down, and then we have access to the front of the spine. It is a minimally invasive procedure with very limited tissue disruption or pain. After we've gotten access to the front of the spine, we take out the damaged disc and we will put in either a bone graft or a metal spacer to replace the damaged disc after we've taken the pressure off the nerve. Following this, we'll place a plate in front of the spine to hold the bones and the implant in its location. Critical part of the surgery is that the bones then fuse together, generally between 3 and 9 months. The procedure for a single level ACDF generally takes 45 minutes to an hour. A 2-level ACDF will take approximately an hour. Preoperatively, the patient will come in, be assessed, go into the operating room. There'll be half an hour of setup time, approximately 45 minutes to an hour of operating time, and half an hour of wake-up time. Most people, when they undergo a single level or 2-level anterior cervical discectomy infusion, will go home the same day. Sometimes, some people will stay overnight. A 3-level fusion or a 4-level fusion, generally people will stay overnight as well, but everyone varies slightly. No one's symptoms or general medical conditions are the exact same. After surgery, most people will have mild to medium swallowing difficulties that generally last 7 to 10 days and slowly get better. There's no perfect way to improve these symptoms. Light pain medications like Tylenol, eating cold food and simple food definitely helps the symptoms. Most people's swallow and sore throat gets better after 7 to 10 days. In rare cases, it can be severe and last longer. Generally, people start to feel a lot better after 2 to 3 weeks after surgery, and after 6 to 8 weeks, they feel almost back to their normal selves. During the postoperative period, simple activities of daily living and simple movement are encouraged. You cannot damage your surgery with normal activities. Putting on your clothing, doing simple gentle exercises are all safe. You should avoid very heavy lifting and very extreme activity until your fusion has occurred. And this will be assessed on x-rays, generally at 6 weeks, 6 months, and 1 year post-operatively. For my patients, I generally use steri strips on the skin with a dressing over it post-operatively. I encourage you to remove your dressing 3 to 4 days afterwards the surgery. These steri strips will slowly start to fall off after 5 to 10 days. If they remain longer than 7 to 10 days, you can gently dab them with alcohol or a soft sponge with water, and that'll help them to fall off. I don't start physical therapy for my patients until approximately 6 to 8 weeks. I let the person heal the neck discomfort improve, the swallow difficulties improve, and then we start physical therapy after our first post-operative appointment at that 6 to 8 week mark, when we've seen that the x-rays are good. For my patients, for a single level or a 2-level ACDF, I generally will not use a cervical collar after surgery. Sometimes we will prescribe a cervical collar if somebody has a high risk of the bones not healing. High risk factors include diabetes, osteopenia or osteoporosis, and other medical conditions. And I'll discuss that with you preoperatively if you may need one. For some people with a high risk of a non-union or the fusion not occurring, we will use bone growth stimulators that electrically stimulate the bone to grow and may help the bone heal quicker afterwards and avoid a non-fusion. Benefits of surgery: for pain going down the arm, sharp pain generally improves in most people. Now the timing varies. Some people with sharp pain down their arm can improve almost immediately post-operatively,